We interrupt this program for breaking news from the Global National Newsroom.
Hello, thanks for joining us on TV and online. I'm Robin Gill. We're waiting for Prime Minister Justin Trudeau to deliver his latest update on Canada's response to the COVID-19 crisis. In about 15 minutes, Prime Minister Trudeau will step outside of Rideau Cottage, his home in Ottawa. We're keeping an eye on the situation for COVID-19 infections across the country. There are more than 14,000 cases across Canada. More than 2,700 people have recovered, but over 250 people have died, with 25 new deaths in Ontario reported this morning. Ontario's total has risen to more than 4,000 cases. There are nearly 7,000 cases in Quebec, the highest of any province. Alberta, more than 1,100, and BC, over 1,200 cases. Globally, there are more than 1.2 million cases. At least 66,000 people have died worldwide so far. Let's bring in our Mike LeCouture, who's in Ottawa. He's doing double duty hosting the West Block today. Mike, what are we expecting from today's announcement?
Yeah, we're expecting the Prime Minister really sort of to guide Canadians through how to apply for that CERB, that emergency benefit package that they've been announcing and talking about for so many weeks. The portal for online goes live tomorrow, and they've actually tweeted out last night, the Prime Minister did, a bit of a sort of guide to how they want people to make sure that they don't overwhelm the system. So just give you an idea, and it goes by birth month, and this is what they want. On Mondays, so starting tomorrow, anybody born in January, February, and March can apply. Then on Tuesdays, because they know that this will be for weeks to come, so on the 7th, you'll have people for April, May, or June, if that's your birth month. And then you go on Wednesday, July, August, and September. And then finally on Thursday, April the 9th, if you are born in October, November, or December, then you can go on the portal and apply. They're hoping that that will sort of prevent a massive backlog and even have the servers crash. And then for Friday, Saturday, and Sundays, they're saying that's kind of open to anybody else who wants to apply for it. And they're really trying to make sure that they get it out as quickly as possible. To that end, the Prime Minister has said that if you've already signed up for direct deposit, and we've seen some issues online, if you went to CRA, the Canada Revenue Agency's website, difficulty trying to get that sort of My Account signed up. But if you have already, the Prime Minister has said you could receive your payment within 3 to 5 days. Otherwise, if you are doing it by mail, you can expect that within 10 days. So they're really trying to speed things up and make sure that everybody does it virtually. And that's kind of what we expect to hear from him today. Also, you know, there have been questions as to, you know, some of the spread and how to sort of contain it. Don't think he'll address that today, but as you mentioned, I'm hosting the West Block this week, and we did an interview with the Immigration Minister, Marco Mendicino, and asking him specifically about some of these outbreaks that we've seen with temporary foreign workers. There have been little clusters that have been sort of popping up, especially in BC. And one of the difficulties is these are people who have had these sort of carve-outs to the immigration and to the travel ban that we've seen in the past. But because temporary foreign workers are such an essential part of our food chain and our food supply, they are allowed to come into Canada. They're supposed to be in a 14-day self-isolation once they come before they start working on the farms. But when I spoke to Marco Mendicino today, he acknowledged that there has been a bit of an issue with some of these outbreaks. And here's what he had to say with how they're hoping to sort of contain them.
Absolutely critical that they are able to continue that work to maintain the food security of all Canadians. Having said that, it's also mandatory that they abide by the isolation period, the 14-day isolation period that everybody coming back into the country has to comply with. And here, our expectation is that the agricultural sector and farmers are keeping up their end of the bargain.
Okay, Mike, we know that there are many Canadians who are still abroad, and Canada is trying to bring them home. Can you tell us more about that?
Yeah, there has been an all-of-government effort and around-the-clock effort from what we're hearing to try and get people home. Just yesterday, Foreign Affairs was saying that they have flights coming back from Peru, Lebanon, Algeria, Trinidad and Tobago, Poland, and India. More flights are in the works, but understanding how difficult that is, trying to get Canadians to the airports, trying to coordinate with all of the different countries. We've said this before. different countries have their different rules as to whether or not people are allowed out and about, and trying to negotiate with these different countries to say, look, we need these Canadians to get to this airport at this time. I mean, I remember how much it was well publicized when Canada was trying to get Canadians out of Wuhan, China, and trying to make sure that you had special authorization from local authorities that you had to show at checkpoints. Unclear if that is what's happening in these different countries, but we are still hearing stories of people that are still stuck in places like Peru because it's been difficult. Either they're under lockdown there, or the countries have just said, look, nobody in, nobody out. Also, the different negotiations of trying to say, look, this flight crew that is going over, people who know any of these flights that go to places like India, you know, these crews need to rest when they get there, but to make sure that they are not put in self-isolation, that 14-day self-isolation when they get there. The Canadian government has to negotiate with the government of India and say, look, we need to make sure that these people are given special provisions, that they can sleep one night in India and then be able to come out right away and be guarded in that way so that they can bring these people back. So all of that behind-the-scenes stuff is going on, and maybe Canadians think, well, it's easy, just fly in and fly out. But there really is a machine behind the scenes that is going into this, Robin, that makes it a lot more difficult to get these people home. But, you know, Foreign Affairs is doing their best to try and get as many of these people back to make sure that when they do come back, then again, they are tracked 14 days self-isolation when you get back on Canadian soil to make sure that you are not infected and that you don't infect the rest of the population, because that's also a consideration. Don't forget that if these people are coming back, there are sometimes difficulties in trying to screen them when they come back, when they get on that plane. Foreign Affairs have said nobody with any kind of symptoms will get on that plane to come back. So there has to be that kind of organization in that, and it's difficult. So those flights are continuing to come home, though, Robin.
Right. We should actually mention that Global Affairs Canada sent out a list of the countries where Canadians still are, and we're trying to get those repatriation flights out of there and negotiate, as you were mentioning, Peru, Lebanon, Algeria, Trinidad and Tobago, Poland, and India. Let's remind our viewers about the self-isolation that these people face once they get back here.
Yeah, 14 days, obviously, that you have to, when you come home, you are not to go and stop at a friend's house. You are not to stop anywhere, the grocery store, to pick up anything. This is when you have to lean on your neighbors, lean on your friends. Make sure that you go directly home. The government has been very clear on that. And then stay home for those 14 days. You can maybe crack a window, open the door, go on your balcony. Do not leave your home, though. It has been clear, but unfortunately, some people feel like, oh, well, it's nice out. I want to get a little bit of a walk in. But you really have to stay home. And the reason for that is to make sure that you pass that incubation period of COVID-19 that health officials have said, look, it's 14 days. Make sure that you do it. I know that there are some people that have come back from Costa Rica, and somebody I was talking to yesterday that said, look, my self-isolation should actually probably be up if you want to go down to the hour at 2 p.m. today on Sunday, but I'm going to make sure I'm going to make it Monday, just to be clear. And even then, even if you do come out of self-isolation, don't forget, you're not allowed just to walk about and go around and go to different grocery stores. The order still remains. Go out only if you have to. Try and make as few trips as possible. And if you do go out, just make it one person in the household. Go get the groceries, come home right away. Try and make sure that you are not visiting multiple places along the way, because we have to make sure that everybody stays home as much as possible to prevent the spread of this virus.
All right, Mike, we'll get back to you after the Prime Minister does his daily address. We want to remind you that dozens of Canadian travelers could begin disembarking a cruise ship docked in Florida today. The Coral Princess arrived in Miami yesterday with 97 Canadian passengers and 2 Canadian crew members. All passengers will have to be screened for signs of the coronavirus before being officially allowed to leave the ship and making their way home. A handful of people on board the Coral Princess have already tested positive for COVID-19. 2 people have died. The owner of the ship, Princess Cruise Line, says the deceased aren't Canadian, and it's unclear if the deaths are related to the new coronavirus. Global News has learned Ottawa is monitoring 6 other cruise ships still at sea with dozens of Canadians on board. We have a few moments before the Prime Minister is about to speak. Let's bring in David Aiken. David, let's talk more about that Canada Emergency Response benefit. You're hearing from our viewers and who have a lot of questions.
That's right. So let's run over what this is. Again, it's the CERB. Get used to that. And as Mike said, the portal opens tomorrow, sort of in stages. This is a flat rate benefit, $500 a week, and you can get it for 16 weeks. Who gets it? Anyone who has lost a job because of COVID-19 after March 15th. And I'll come back to that date in a second. If you've lost a job and you're EI eligible, if you're self-employed, if you're a contract worker, normally those people would not get EI. Anybody who's lost work because of COVID-19 can be qualified for this $500 a week benefit for 16 weeks. Now, as we reported last week, there would be people who applied and are getting EI after March 15th that might only be getting $350 a week in EI. You're getting a raise, and it's going to be automatic. Anyone who applied for EI after March 15th automatically moves into this CERB. And Robin, that's a lot of people. 2.1 million Canadians have applied for EI since March 15th, and the government announcing just today that 1 million of those claims had already been processed. But again, you're automatically going to be moved to the CERB. Now, people before March 15th, if you were getting EI or applied EI before March 15th, you're not eligible for the CERB. And this is where we've been getting people who've been sent. I've got lots and lots of viewer mail on this. People, for instance, who might have been laid off in the oil patch in January, their employment benefits, EI benefits, may be starting to run out. Obviously, they can't go out and look for work. They've been told to stay at home. What happens to them? We hope to perhaps hear from the Prime Minister on that today. There's a lot of cases with students who have been in school up until about this time. They had employment lined up for the 4 months, say starting in April, May, June, and July to save to go back to school. Those jobs have disappeared. What do those students do? Can they get some help through the CERB? Right now, the rules of the eligibility say no, they can't. Seasonal workers, another group of people who would have been expecting maybe to go out to work over the fall and cannot, or those job offers have been withdrawn. So lots of questions. The CRB is going to help millions of people. There's no question about it. But because of this March 15th cutoff date, there's going to be a lot of people sort of looking for some help. Now, we will see the wage subsidy program for businesses kick in possibly towards the end of April or the middle of May. And remember, that program is intended for employers to get a wage subsidy of 75% of the wages of employees. And they may be able to say to some of these people on EI that's expiring, you can come back to work now, and the government's going to pay 75% of your wage. So that's one of the mixes here as well. One last thing on this CERB that the Prime Minister is going to talk about in a second. Estimated cost this year, $24 billion. That's right, $24 billion. And the CERA saying it is expecting 4 million Canadians to be on this program by the time it's done. And one of the reasons Mike was explaining this staggered, by month application day by day, the CRA expects 3 million Canadians to apply for it starting tomorrow. This is going to be a very big deal and a big test of the ability of the Canada Revenue Agency to handle this influx. They say they're ready because don't forget, this is the group that around this time of year is taking in 15 million tax returns and often sending out millions of checks in your income tax refund. So the CRA believes they're ready to go. I should point one more number, Robin. The CRA, they want you to apply online for the CERB, but if you can't, you don't have an internet connection, you'd rather do it by phone, the Canada Revenue Agency has a system set up and it's hired thousands of new workers, and they say they can process 1 million applications a day over the phone for the CERB. So this is going to be, this is just a colossal government project we're going to start seeing tomorrow.
And I'm sure it's going to come in waves as we get more people losing their jobs as this goes on and on and on. And with the projections suggesting that this could go on to the summer, it's going to weigh heavily on the economy. Let's talk about the battle over masks. The White House is saying to 3M, limit those N95 respirator masks that are so desperately needed around the world. The Prime Minister talked about that yesterday. Can you elaborate on that?
Yeah, well, the first thing the Prime Minister said he's not going to do is retaliate for this order from the White House to forbid 3M, which is the world's biggest maker of N95 masks. 3M's been forbidden to export to Canada. Trump saying yesterday, late in the afternoon, that we want all of these and we don't want them to go anywhere else. The Prime Minister is trying to impress on the President that the safety of all our citizens depends on integrated healthcare networks. For example, 1,500 Canadians Canadians who live in Windsor, Ontario, go to work every day in hospitals and clinics in Detroit, Michigan, one of the hardest hit hotspots in the United States. And those 1,500 Canadians are trying to save American lives. And I'm not sure if the president has been told about that, but that's a good example of the tit for tat going back. There's a pulp mill in Nanaimo, BC, that makes a very special kind of pulp using western red cedar, only grown in Canada. And the quality of the fiber in this kind of pulp is perfect for the making of surgical masks and gowns and drapes in hospitals. All of the pulp from this Nanaimo mill goes to an American customer that makes these surgical masks and gowns and drapes, some of which come back to Canada, some of which goes to America. Those are just some examples of how Canadian people and goods and supplies are helping save Americans. And the Prime Minister is trying to say, listen, let's negotiate this to say N95 masks. There'll be plenty for Americans, and Canadians need them as well. Premier Doug Ford was hopping mad yesterday because some of those masks that are being made by 3M in Minnesota were supposed to be in Ontario this week, and he is really disappointed in Donald Trump, he said, and the thinking there is, I guess you know who your friends are when times get tough. Right now, as far as Doug Ford is concerned, Donald Trump is no friend of Canada's.
Okay, David, the Prime Minister is still inside his cottage. We still haven't seen him come out yet, and you know he's going to come out just as soon as I ask you a question. But let's talk about homemade masks. They seem to be a booming industry, and you mentioned yesterday that Theresa Tam is very reluctant about people using their own masks. Tell us about that.
Yeah. Right. So the Canadian authorities have not yet said, hey, everybody should wear a mask. And of course, you've seen in the United States.
And the door is open, David. We're going to interrupt you right now and listen to the Prime Minister.
We'll talk about this later. Okay.
Hello, everyone. Bon dimanche. Ce matin, je veux d'abord remercier tous ceux et celles qui travaillent en fin de semaine.
This weekend, truck drivers, grocers, pharmacists, and health professionals, as usual. Thank you. Thank you. Today, I would also like to thank our farm workers who are feeding our families. You are going through some particularly difficult times, but it's thanks to you that we can stay at home in confidence, knowing that you are working to feeding our families and our communities, and we really, really appreciate everything you're doing for us, and we will be there to support you.
Over the past few weeks, we've all had to make changes to keep each other safe and healthy, and it's a big adjustment. While we still have a lot of work to do, we're making good progress on getting you the support you need as quickly as possible. And that's what I want to start with today. Earlier this week, we announced more details on how you can access the Canada Emergency Response Benefit if you've lost your job or your paycheck. Starting tomorrow, you'll be able to sign up to receive this support by going to canada.ca. If you choose to direct deposit, you will get a first payment within 3 to 5 days. If you choose to receive your benefit by mail, you'll get money within the next 10 days. Earlier
this week, we shared more details on the manner in which you can obtain the emergency benefit, response benefit, if you've lost your job or your paycheck. Starting tomorrow, you can go to canada.ca to register. If you opt for the direct deposit, it'll take 3 to 5 days to receive your first payment in your bank account. If you choose to receive your benefit by mail, it can take up to some 10 days.
It's hard to keep your spirits up these days. But one thing that should give us all hope is the way we've come together as a country. Crises such as this one test the limits of our solidarity. And in these difficult times, we've seen businesses step up to help protect our healthcare workers. We've seen doctors and nurses come out of retirement. We've seen people raise money for local food banks, check on their friends, and help our most vulnerable. Many of you may be wondering how you can help, and I want to remind you that the very best thing you can do to fight this pandemic is to follow public health recommendations. Wash your hands and stay at home, except for critical things like getting groceries or medications, and try to make that trip only once a week. And if you do have to go out, keep a safe distance of at least 2 meters with others. That's how you can keep doing your part. But for those of you with specialized skills looking to help our frontline workers, we do want to hear from you. Health Canada is building an inventory of specialized volunteers that provinces and territories can draw on to provide more support to our healthcare workers. This could include tracking cases and tracing contact, as well as collecting and reporting data. If you can help, please sign up online at canada.ca/coronavirus. Applications will be open until April 24th. We're also offering full-time jobs to all reservists in the Canadian Forces. We're contacting reservists across the country to see if they're interested and offering them the same pay and benefits as regular force personnel for the coming months. Bolstering the military's ranks will help offset some of the economic consequences of COVID-19 and ensure that our communities are well supported. Dans cette crise, chaque geste.
In this crisis, every act counts. If you refuse to follow the recommendations of experts, you not only endanger your own lives and that of your loved ones, but you compromise the health of all the members of our society. And I'm not saying that for dramatic effect. 233 Canadians have lost their lives because to COVID-19, and hundreds of families are therefore grieving. To all the loved ones that are grieving, my most sincere condolences. We're going through some very painful times, but we are there for you. Now, to end this crisis, we all must be aware of the consequences of our actions. If you don't do your share, your fellow citizens will pay the price, but it also works the other way. If you do follow the advice of experts, all of the community will benefit from it. So let's concentrate on that. Let's continue each person to do their own share, and that's how we will get through this trial together.
I want to close today with a message for kids. Thank you all for sending in me your questions over the past few days. Dr. Tam and I had a great time answering those questions this morning. Later today, astronauts Jeremy Hansen and David Saint-Jacques will be on YouTube, so be sure to tune in. David just returned to Earth after spending many months in space, and he knows a thing or two about staying indoors and only talking to friends and family via video conference. I know these are tough times for kids right across the country and indeed around the world. But know that the support you're giving your parents, and all of us as we work through this, the way you're helping out, the way you're focusing on doing your homework and keeping your schoolwork up, and the way you're learning to adapt to this new situation that we will all remember for the rest of our lives. Thank you for everything you guys are doing to keep us getting through this. Je veux terminer avec un message pour les enfants.
I would like to close with a message for young people. Dr. Tam and myself had a lot of fun answering your questions earlier this morning, so thank you for them. Later today, astronauts Jeremy Hansen and David Saint-Jacques will appear on YouTube to speak to you kids. David has just come back to Earth, having spent several months in space, and I'm sure he has a lot of advice for how to spend time indoors. And beside that, he knows what it is to talk to your friends only over video conference. I know it's tough for kids and for everybody. It's even tough not to go to school, not to see one's friends. But the work that you're now doing around the dining room table to do your homework and all that, the help that you provide in the house to your parents while we're going through this very difficult trial is really appreciated. And when we will have gone through this crisis together, we will remember it for all of our lives. So thank you for all that you are now doing. Please carry on doing this good work. Thank you, everybody. I'll now answer questions. Thank you, Mr. Prime Minister. Question period starting with the phone moderator.
Merci, thank you.
Thank you.
The first question is from David Youngren from Reuters. Your line is open. Please go ahead.
Yes, thank you, Prime Minister. If I can switch topic to the temporary foreign workers who are going to be working on Canada's farms, what are the plans to get these 60,000 people to Canada?
We understand that our agricultural producers and farmers right across the country rely very much, as well as fish processors in the fisheries industry, rely on temporary foreign workers to make sure that we can feed our country. That has been the way for many, many years, and we are, of course, looking to ensure that we're able to receive temporary foreign workers, that they will be properly quarantined for 2 weeks before they start doing the work that is so necessary for us all. At the same time, we see many, many Canadians out of work who are wanting to help out, students who are looking at opportunities for summer jobs that they might not otherwise have. And we know there are many people interested in helping out in terms of feeding this country. So we're going to be having more to say in the coming days and weeks about how we're going to pull together and make sure that our agricultural producers, our fisheries, our agricultural transformers are going to get the support they need.
We recognize that it's very important for our farmers who are working so hard, as well as for the fish processing industry, to have these foreign temporary workers to help out during the season here. We need to bring in these foreign workers to do this work, as they have been doing it for some years now, and we will ensure that these workers are isolated before starting to work on our farms throughout the country. At the same time, I'd like to point out that there are many people, including a lot of young people, that don't know what jobs they'll be having this summer, and that perhaps would be interested in giving a hand on the farm to help feed our country and to do this important work. And I do hope that we will be able to find ways together to help our farmers and to continue to feed Canada properly.
Secondly, you're speaking to us every day. The Deputy Prime Minister is either having meetings or speaking to us. Dr. Tam is speaking to us virtually every day. What are you guys doing to prevent burnout? I mean, there's no way you can continue at this pace. Are you drawing up some sort of rota?
We are looking at how we're all going to work through this issue. It takes an adjustment for all of us. I have very much enjoyed my opportunity to speak directly with Canadians every day, and we'll be continuing trying to do it almost every day, at least, for the foreseeable future. But we also know that it's extremely important for people who are doing important jobs to take time to make sure that they're getting the support they need. I've spoken with our ministers many times about needing to make sure that we're pacing ourselves, because we do know that this situation is going to last a number of weeks, a number of months, and therefore we have to make sure that we're all supporting essential workers, particularly our healthcare workers, our truck drivers, our food delivery people, but it counts for government officials as well.
Thank you. Next question.
Merci, thank you. The next question is from Bruce Campion-Smith from the Toronto Star. Your line is open. Please go ahead.
Prime Minister, good morning. Just wondering if there are any updates on the N95 masks. Just wondering how critical was the 3M production Canada's supply, and you haven't spoken to President Trump yet. Just wondering if that's on the radar and why there's been a delay in that conversation.
We continue to know that we have to get the necessary equipment and PPE to our frontline health workers. There is a global shortage right now where people are trying to get as much as they can, and we are continuing to work with all our traditional suppliers and new suppliers to make sure that we're providing the equipment needed for Canadians. That's why we've ramped up domestic production as well, and look to have the ability to fill all of our needs domestically within the coming weeks. At the same time, the conversations continue with the American administration in terms of solving this issue, because, as I've said, both sides of the border benefit tremendously from the flow back and forth of essential supplies and of medical goods and services. And that is the point that we're making to the administration. I am confident that we're going to be able to solve this, and I look forward to speaking with the President in the coming days.
We recognize to what extent it's important to provide the essential medical equipment to our frontline healthcare workers. That is why we're working with suppliers throughout the world to obtain the necessary equipment, and we are confident that we will continue to receive this equipment from various places in the world. In addition, we're working specifically with the government of the United States to solve this little issue. We know that it's in the interest of both of our countries to continue to ensure that goods and services, essential goods and services, move unobstructed over our borders, because they do so both ways. It would be unfortunate and difficult for both our countries if that were to be interrupted. So we're working in a very constructive fashion with the American administration, and I am looking forward to speaking to President Trump in the days to come.
As a follow-up, Prime Minister, you referenced it yourself that thousands of university and college students are coming out of school, no immediate prospect of finding summer jobs, and are now worried about tuition and expenses when they return to school in the fall. The agriculture may work for some, but obviously not for those in the cities. I'm just wondering if that's on the government's radar screen. I understand they won't qualify for the emergency benefit, and wondering what other help might be forthcoming.
This is an issue that we are very, very aware of, from modifications to the Canada Summer Job Program to looking at direct support for students. We know that we need to do more for young people as they come out of university and look for projects and ways of securing income this summer. That is something that we are very closely engaged on and should have more to say in the coming days. We recognize
that for young people finishing university and we're counting on a summer job, perhaps in tourism or other such areas, in order to pay for their studies in the next fall, are quite worried about how they will be able to get through this difficult period. We are having a close look at the different ways in which we might be able to help them. We do recognize that this is a real need in our society, and we will be there to support our young people.
Thank you. Merci. La question suivante
The following question is from Raymond Fillon, TVA. Good morning, Prime Minister. It's now been 2 days that the presidential order about the famous N95 mask from 3M was handed down. Since it's an urgent matter, how come you haven't managed to speak to Mr. Trump? Is he refusing to take your call? No, we're working on, as we usually do, at all levels of the administration. It's been some years now that we're involved with this American administration on various issues, and we have developed the capability to solve problems and issues that arise, and we're doing everything that is necessary to solve this problem in the proper fashion, because we know that it is essential to have the necessary equipment for our first-line workers.
Many years that we've been working now with this particular American administration, and we've developed certain abilities to work with them in the right way. We're continuing to engage constructively with the entire American administration to highlight how important it is that goods flow both ways and continue to flow both ways across our border. We will continue to do the right things to ensure that our frontline workers and our health professionals get the equipment that they so importantly need.
Avec un geste pareil en pleine période de crise, quel genre
having done this in a crisis, what kind of an ally would you consider Mr. Trump to be, and what's his attitude in your opinion? My job is to work with the Americans, to work with our allies and partners throughout the world, serve Canadians and ensure that they have everything that we Canadians need, and that is what I will always do.
Last question.
Merci, thank you. The next question is from Mark Bonikowski, Sun Media. Please go ahead.
Good morning, Prime Minister. Today is the 484th day that Michael Kovrig and Michael Spavor have been detained arbitrarily in Chinese jails. The last we heard was the Chinese embassy back in March saying that Mr. Spavor was allowed to call his very ill father by telephone, and that they have been given better food to build up their immunity against COVID-19. Have any of your emissaries in Beijing been able to visit them and give us an update on their conditions and well-being?
Thank you for your question. I can assure you that not just our ambassador and embassy in Beijing, but the government of Canada continues to be focused and engaged on bringing these two Canadians home. We recognize the difficulties that Michael Spavor and Michael Kovrig are facing and have faced for a very long time. It continues to be an issue we bring up continually with the Chinese government, and we continue to impress upon them that it is important that they be treated better and indeed that they be released to come home to Canada. And we will continue that work.
But do you have an updated report from our own people on the ground there?
We continue to engage with them as for consular support on an ongoing basis, and I will ensure that there is a further update in the coming days.
Bonjour, Monsieur le Premier ministre. Christian Noël de Radio-Canada. Ça va bien?
Christian Noël, Radio-Canada. How are things? Fine. So the Canadian Emergency Response Benefit can be applied for tomorrow. I have some questions. Is it worthwhile to work at part-time for $1,500 a month, or should I not rather stay at home and get the $2,000 a month? What do you say to workers who are facing that kind of a dilemma, and will you change the system accordingly? We had to implement unprecedented measures to help millions of Canadians who are suddenly, not through their own fault, without any income. We want people throughout the country to stay home and not work unless it is in essential services, and for that we had to quickly develop programs to help the largest number of Canadians possible. We do recognize that in some industries, some workers might be faced with exactly that kind of a dilemma, and that's why we're working to develop ways to encourage those who are working in essential areas to continue their work, which is important work during this difficult time. And we do recognize that it is a situation where there's no unique solution that works for everybody, but as we move forward and we find out of these problems and concerns, we seek out solutions and we will continue to work at it.
We recognize that in moving forward with unprecedented measures to help as many Canadians as possible, we had to move quickly. We recognize that millions of Canadians are suddenly out of work and needed support so that they could stay home, so that they could take care of their families and follow public health directives during this time. That was the priority, and that is why we moved very quickly to get help out to Canadians. We recognize that anytime we're doing big measures like this, there will be gaps, there will be challenges in implementation and unforeseen consequences, and that is why we are working very carefully to ensure that people who are working in essential industries, people who perhaps are facing choices about whether they continue to work or whether they receive the CERB, are able to make the right decision, not just for them, but for our community and our country. These are things we're going to continue to working on, and we'll have more to say in the coming days.
Qu'est-ce que vous comprenez du dilemme de ces personnes-là et des entreprises?
What do you understand about the dilemma of these people and businesses that have difficulty to hire employees because of that? And what change will you bring about? Well, we're discussing possible changes to the CERB to encourage people to continue working when it's an essential service that is not being paid at the rate of $500 a week, which is the level of the CERB. And we do recognize that this is a difficult situation and that we'll have to work to find a solution for it, and we are doing precisely that to try and solve this issue.
Prime Minister Janet Silver, Global News. Yesterday you said millions of masks were en route from China. I'm just looking for a clarification. Were those N95 masks?
There was many of the shipments are a blend of surgical masks and N95 masks. I'm not entirely sure which particular proportion was in that shipment, but we can get the more answers to you soon.
And BC Health Minister Adrian Dix on Friday called on the federal government to be more aggressive with enforcement and screening at the border. Just wondering what steps are being taken on that front.
Well, first of all, we recognize that the a vast majority of Canadians who were stuck overseas have now returned to Canada, and therefore those flights are being reduced, as there still are a number more to come in. But we recognize that there will be fewer and fewer travelers arriving in Canada in the coming days and weeks. But as we continue to move forward, it is going to be extremely important that we continue making sure that everyone isolates, understands that they need to be under quarantine for 2 weeks when they enter Canada in order to not be spreading COVID-19.
Ashley Burke, CBC News. Donald Trump has said that he's starting to move millions of doses of drugs used for autoimmune diseases into an emergency stockpile to make it available to U.S. coronavirus patients. What happens to people in Canada who are cut off from vital drugs they need for other diseases? And do you plan to speak to Trump about this?
We know that it is absolutely essential that people continue to get the essential medications that they need, whether it's related to coronavirus or not. That is why we're working with the Canadian drug industry. We have a significant pharmaceutical industry in Canada to source the things we need, and we're continuing to work with suppliers and partners around the world on the delivery of life-saving drugs that are necessary beyond COVID-19 treatments. We're going to continue to ensure that every step of the way Canadians get the support and the medication that they need. We recognize
that even during this coronavirus crisis, people need essential drugs to continue to have a good quality of life. So we will be working with the pharmaceutical industry here in Canada and with our worldwide partners to ensure that these people receive the drugs that they need.
Situation in particular, and as well, what's being done behind the scenes to make sure the CRA website doesn't crash tomorrow when it starts processing all of these CERB applications? Can the system handle it?
We are working very hard to ensure that our systems are robust enough to handle the unprecedented demand. There have been discussions around different ways of ensuring that the system is not overloaded, and we will continue to keep Canadians apprised of that. At the same time, yes, I will continue, and we will continue to work with the American administration on all issues that matter to Canadians. We recognize
that there will be an unprecedented demand on government computer services, which is why we have implemented measures in order to obviate an overload on the system. But we will also continue to ensure at every step that Canadians do receive that which they are entitled as quickly as possible.
Yesterday, President Trump held a press conference and he seemed to give contradictory remarks on 3M. He said at one point, we need the masks, we don't want other people to have them. He then went on to say that 3M could sell masks to other countries. So can you give us a clear understanding of what the United States has told Canada is their policy on the 3M N95 masks?
We continue to work very closely with the American administration on solving this situation. We understand how important it is for goods to continue to flow in both directions over our border. There are essential medical services and supplies that Canadian companies deliver to Americans, and there are essential medical supplies delivered by American companies to Canada. We will continue to work together to ensure that those flows are not interrupted, because it would be harmful to both of our economies and both of our citizens. That is why we continue to work with the Americans on this issue.
When we've asked you about this 3M situation previously, you've referenced the fact that there are many Canadian nurses and doctors who live in Canada but work in the U.S. Yesterday you said that retaliatory threats or retaliation on this is not productive, but I just want to be very clear. Will you at any point ban nurses and doctors who live in Canada to go work in the U.S., or is this just a reminder to President Trump?
I'm not going to engage in hypotheticals. I will say that we will do what is necessary to keep Canadians safe, and we will do it in as constructive a way as possible. That has always been our approach with the Americans, and it has been effective until now, and will continue to be. Nous reconnaissons que nous avons besoin
We recognize that we need to ensure the protection of Canadians and the supply of equipment that is necessary. And we know that working constructively with Americans, we will probably be able to, we have a good opportunity to settle the dispute. I think it's not a good idea to exact reprisals to achieve our aims, and that's why we're going to continue to act as good friends. Have a good Sunday.
Prime Minister Justin Trudeau with his daily update on the COVID-19 crisis. Let's go back to Mike LeCouture in our Ottawa bureau. Mike, the Prime Minister was getting a lot of questions about Donald Trump's presidential order to 3M, to that company, to stop sending masks to Canada. But it's not that easy that he can just call up Donald Trump toot sweet. There are channels and protocols that he has to follow.
Yeah, and obviously they do have a relationship, as he mentioned, and a constructive one. It says it's interesting to underline how he sort of said, look, it's been many years we've been working with this relationship, and we've found, and I'll just sort of look at it here for a second, we've found certain abilities to work with them in the right way. Interesting how he puts it, because sometimes those abilities have been roundabout ways, and I say that because colleagues at CBC have reported that Jared Kushner, who has developed a very good rapport during the NAFTA negotiations, that of course is the son-in-law of Donald Trump, and he's a special advisor to President Trump, has developed a very good rapport with Katie Telford, the Prime Minister's chief of staff. So is a call between the two of them or a couple of texts in order? That's a possibility. That the Prime Minister didn't mention that he will have a conversation with President Trump at a certain point in the coming days. But it's also interesting in that last question there was a very clear question when that reporter said, look, you said on Friday that there are a number of nurses from the Windsor area that go down to Detroit. So are you going to unequivocally say that you will not prevent these people from going down to work in the Detroit healthcare system? And what the Prime Minister said was, I'm not going to engage in hypotheticals. That wasn't a no. And I'm not saying that he's going to say yes, but it wasn't as if he had said, no, we're going to prevent these people from going over the border, or we're not going to prevent these people from going over the border to work there. So it's interesting that in this sort of reminder to the president, I think this is part of the game that you have to play here and say, look, there's a number of things that go your way, President Trump, in terms of, as David Aiken had mentioned before all of this press conference, and that there are materials that go into a number of these masks and a lot of the protective equipment that is used in hospitals that are manufactured here in Canada, or those resources are sent to the U.S. to make these masks. And I think that's what the tone will be of any conversation that happens, or any of the discussions that happen, that the Prime Minister said that Canadian officials will have with their American counterparts. And just that gentle reminder, like they've had through the NAFTA negotiations, that look, don't forget, you'd benefit from this relationship as well. Some of these things, are essential to you making these. And sometimes, we have heard from sources within the government that sometimes the president needs to be reminded of these things because either A, he doesn't know, or B, he completely forgets about them. And that was the case in NAFTA negotiations, where sometimes the trade imbalance had to be sort of reminded of the president, rather, saying, look, I know you're going out in public and saying this is the trade imbalance. It's actually not that. Here are the numbers. And then the tone of the conversation we have heard in those NAFTA negotiations did take a bit of a turn, or at least, softened a little. So will that now be in order? Will, the Prime Minister finally be able to make that phone call? He's had regular phone calls with the President, so it's not like it's going to be that difficult. But I think the timing has to be right, and they seemingly want to have this sort of work the back channels first, and then see whether or not the conversation needs to happen between the two of them. Because let's face it, if he does pick up the phone and say, we need this to happen, and it doesn't happen, well, then that's an undeliverable on the part of the Prime Minister, that he will want to make sure that the final call is to President Trump and say, so do we have a deal here? We're okay with the 3M masks coming over? Yes? All right, then, we can walk this over the finish line. I think politically, that's how they want it all to look, and potentially that's what they're working on behind the scenes, Robin.
It is reminiscent of the NAFTA negotiations, but the Prime Minister did say yesterday that he didn't want to take any retaliatory measures because it wouldn't be good for both sides, and he did want goods to go back and forth across the border. Another question he was asked was about temporary foreign workers who are very important to the agriculture industry here in Canada and obviously important to maintain the supply chain when it comes to food. You talked to the immigration minister about that today. What did he say?
Yeah, and he was sort of saying, look, we also have to make sure that all of these sort of carve-outs that were made when we closed the border to the United States and made sure that nobody was allowed to come in to Canada, including people from other countries, that they made these carve-outs for different farms and the different agricultural industries, and as the Prime Minister is saying, the fish processing plants, making sure that these essential workers that come over to do these jobs will continue to be allowed to come into the country to do them, making sure that that does happen. And the Prime Minister has said, look, yeah, and all those rules are still in order to make sure that when they come in, 14 days of self-isolation. But as we've seen in BC, there have been some issues with some of them having COVID-19. And the Prime Minister said he's very mindful of all this and trying to make sure that those people continue to come to Canada to do those jobs. At the same time, he mentioned, hey, look, if there's some students out there who had counted on some other jobs, potentially working maybe for a summer camp or something else. He didn't mention summer camp, but I think that's what he was insinuating, that there's possibility that these jobs might be open if different farms weren't able to, get people into Canada, that there may be these opportunities. And he's saying that, take a look at that, because that could be a consideration, Robin.
All right, we're going to stay with you, Mike, but we want to bring in our chief political correspondent, David Aiken. David, let's talk about the CERB. There was a question about university students who are coming out now. They kind of expected summer jobs, but they are not going to qualify for CERB.
Yeah, and this is something that's been flagged to me all week as I've been reporting on who's in, who's out on the CERB, which, by the way, I should point out, millions of Canadians will qualify. It's a very rich benefit, relatively speaking, $500 a week for 16 weeks for anyone, the self-employed, contract workers, or EI-eligible workers that have lost their jobs after March 15th. And there's the rub. So, of course, a lot of students are finishing up their studies. There's university students and some high school students finishing up their studies right about now and would have been expecting to head off to their summer jobs, wherever they might be. And, of course, a lot of them are hearing now that their summer jobs have been canceled, that there's no work to do. And what do they do? So that's a big gap. And the Prime Minister is saying just a few minutes ago that he's, quote, very, very aware of this problem and expects to have something in the coming days. But there's other groups as well that are going to look at the CERB and it may find it a bit wanting. For example, you lose all $500 a week, all $500 a week of your benefit if you do any work while you're getting the CERB. So if your employer says, well, I can give you 10 hours a week working from home on this or that, earn $100 or so, if you want to do that, you lose all of your CERB. And there's many, I've been hearing from many people in the public safety business, court officers, for example, or those who work in our prisons who are now on reduced hours and might look to some benefit. They can't get the CERB. So this is something the House of Commons Finance Committee, they talked about this last week. I think they'll talk about it a bit more when they meet next week. Could this be modified to say you can have your CERB deducted by 50 cents, say, for every dollar you earn in a job? That's another adjustment. But right now, work 1 hour a week, you lose all $500 a week. So that's one. And again, as I mentioned before the Prime Minister spoke, there's the issue of people who were on EI before March 15th, because CERB only applies to people who lost their job after March 15th. If you were on EI before March 15th, you stay in the EI track. You stay on your EI claim level. So if you're only getting, say, $400 a week, and that, by the way, is the average EI payout in this country, about $400 a week, you stay on $400 a week, even though everyone who applied for EI after March 15th automatically moves to the $500 a week CERB. So those are the three groups I think that the government is really going to want to now start taking into account. Those who are on EI or applied for it before March 15th, students, what do we do about them? And what do we do with people who get the CERB and are able to take a little bit of part-time work here and there? Those three adjustments. I can tell you, speaking, and the Prime Minister hinted at this, speaking to government officials who are designing these programs, this is such a monster program, a $24 billion program. This is such a huge program. Normally it would take our bureaucrats a year, maybe two, to figure out how to deliver this kind of a program. They've been told to figure it out and deliver it in about a week. So this is the big issue here. Get the money out the door rather than design an elegant program.
David, one more question. The Prime Minister says that millions of masks are coming from China, but we don't know exactly what the breakdown is when it comes to the N95 and surgical masks. Why no clarity?
Yeah, this is really confusing because yesterday we asked the Public Services and Procurement Minister, Anita Anand, we asked her, well, how many of these masks are surgical masks? How many are N95? And the response from her communications director, this is the Public Procurement Services Communications Director, was all 8 million coming from China were surgical masks. There was no mention of N95. The Prime Minister just now saying there's a mix of N95 and surgical masks, but he's not sure which. We do know that he said yesterday millions more masks are on the way in addition to this shipment. Maybe he was referring to that. But again, I think clarity is really important at this point in time. And once again, we'll be going back to the government and trying to get a sense of just how many N95 masks are coming from China, because those are the ones we need right now.
All right. Michael Couture, Adrian Dix has called on the federal government to be more aggressive with screening. We have those people who are coming in from abroad, all those planes from Peru, India, Trinidad. We also have the cruise ships, and we're monitoring that situation. Let's talk about that.
Yeah, and the Prime Minister had said that he is conscious of that, obviously, and trying to make sure that when anybody comes in, they go into self-isolation. I mean, early on in this, and it feels like it's been months, but it's only weeks ago, I know that government officials were sort of musing about, well, when people arrive, do we screen them? When they are coming in, do we put healthcare workers at the airports and do temperature scans to understand who has, maybe who doesn't? And at the time, they said, well, we just don't have enough people to staff that and to staff the hospitals. But obviously, something has to be done here because you have to make sure that whoever's coming in potentially doesn't have the virus. So the Prime Minister didn't really sort of answer on that one. But the concern is, and what the directive has been, is if you have any symptoms, you won't be accepted onto the plane. The difficulty is, what if somebody just lies about it? I mean, yes, they signed an attestation and saying that they will, but these people are so desperate to come back to Canada to make sure that they are at home to go through all of this that unfortunately some people may not tell the whole truth about it. So that is one of the difficulties. And I wanted to pick up on something David was mentioning about whether or not people would qualify for the CERB or, that decision if they're part-time work. The Prime Minister was asked by it. One of the journalists from Radio-Canada said, look, what do you say to people who are at home and they're doing part-time work and they're making $1,500 a month, but they can go onto the CERB and get $2,000 a month, and isn't that a better option for them? And the Prime Minister acknowledged that, look, this may be a difficult decision for everybody, but if you are doing work that is essential, if you're still working, they're trying to make sure that they design this so people don't want to jump off jump onto the public dime like that, and to try and make sure that they aren't overwhelming the system. And so I think that is something, as David had mentioned, isn't a design flaw, but something that needs to be considered, and that the Finance Committee will have to tackle that to make sure that people just don't go to their bosses and say, look, I can make more money on this CERB, so if you don't mind, lay me off. It's after March 15th. Can we make a deal here? And I think to David's point, they have to make sure that they sort of close those gaps.
Okay, David, one more question. The two Michaels who are being detained in Beijing, what is the latest on them?
Right. Well, there really isn't the latest on them. The Prime Minister pressed for his own assessment, or our government's own assessment of the two Michaels, and promised that there'd be an update. Obviously, they're continuing to try to. The Canadian officials in China continue to try to press for consular access. Apparently, the Michaels are getting an enhanced diet to improve their immune system via COVID-19. But that's something the Prime Minister is going to update in the days ahead.
All right. And finally, let's talk about the masks again. Where are we headed with this fight with the U.S.?
Well, it's negotiation, but I mean, as Mike underlined when we came out of this, I really looked at that last answer where the Prime Minister did not rule out retaliation. I think he's going to remind the President of how valuable Canadians are to keeping Americans safe.
All right, thanks very much, gentlemen. Let's recap what we heard from the Prime Minister today. Canadians who are out of work because of the COVID-19 crisis can begin signing up for the Canada Emergency Response Benefit, also known as the CERB, and that starts tomorrow. He discussed the need for temporary foreign workers to support the agriculture industry and fisheries, but he said all of those workers coming to Canada will be properly quarantined before beginning work. The government is also looking at ways to support young people who will be looking for work in the summer months. Those are university students who are coming out of classes. Most of those classes have been canceled. And Prime Minister Trudeau says he is confident the dispute with the U.S. over importing N95 masks and other supplies can be resolved. He says he's continuing to work on constructive resolution, but he says his government will do what is necessary to keep Canadians safe. And you can find full details on globalnews.ca, and we'll see you again tonight on Global National. Before we wrap up, the Queen will also address the Commonwealth today on the COVID-19 pandemic. Her message was recorded at Windsor Castle and is set to be broadcast today. Royal experts say it's only the 5th such televised address during her 68 years on the throne, and you can watch for it on globalnews.ca at 3 p.m. Eastern, 12 p.m. Pacific. I'm Robin Gill. Thank you for joining us. We return you now to regularly scheduled programming.
This has been a special report from Global News.
Hello everyone. Bonjour à toutes et à tous. As usual, I'll start with the update on the numbers of COVID-19 cases in Canada. So there are now 14,426 cases, including 258 deaths. The highest proportion of deaths among those aged 80 or older. So obviously keeping seniors safe is a very critical part of what we need to do. And again, remember that these cases represent previous exposures, but we need to thinking about what the risks are now. This means the best bet is to consider that there could be community spread wherever you are, and always practice physical distancing by keeping a 2-meter distance from others. So Canada has completed over 323,000 tests for people in Canada. And just over 4% of these have been confirmed as positive and 95% confirmed as negative. Each day we are adding to our knowledge of COVID-19, keeping pace with the rapid growth of new scientific evidence as it emerges. This has been and continues to be critical to how and when new decisions are taken. There are times we will act with speed over perfection when the price of inaction is high. In other cases, we must wait for the science to catch up while layering up with all the protections that the science has proven time and again to work. So this is why I have been a broken record about tried and true public health.
Stay in, and because of all the decreased activity, I'm sure you may have seen some of these images released by
to help plank the curve. They are learning about social distancing and hand washing while singing different tunes and doing their part to help slow the spread of the virus. This is great, and we can all do the same. We know that these efforts require sacrifice, so we must undertake them together, taking care to look after one another and also to look after our own physical and mental well-being. COVID-19 has reminded us of both our vulnerability and our interconnectedness. We are stronger together. Thank you.
Bonjour. Comme d'habitude, on va commencer en faisant le point sur le nombre de cas de COVID-19 au Canada. On compte en ce moment 14 426 cas au pays, dont 258 décès. Même si ces cas découlent d'expositions antérieures, il faut maintenant penser au risque d'exposition. Plus précisément, la meilleure chose à faire en ce moment est d'agir comme il y avait transmission communautaire de la maladie dans la région où l'on se trouve et de pratiquer un éloignement physique en se tenant à 2 mètres les uns des autres. Nous continuons d'effectuer de nombreux tests au Canada. Plus de 323 000 personnes ont été testées. Plus de 4 des cas de ces personnes ont obtenu des résultats positifs et 95 des résultats négatifs. Chaque jour, nous en apprenons plus sur la COVID-19 en nous tenant au fait des nouvelles données scientifiques à mesure qu'elles sont diffusées. Ces données continuent de déterminer quand et comment se prennent les décisions. Nos actions doivent être plus rapides que parfaites lorsque l'inaction risque de nous coûter cher. Dans certains cas, nous devons attendre que la science se rattrape et appliquer toutes les mesures de protection qui, d'un point de vue scientifique, ont toujours été efficaces. C'est pourquoi on se répète comme un perroquet sur les bonnes vieilles mesures de santé publique. Nous savons qu'elles fonctionnent et qu'elles peuvent nous aider à aplatir la courbe si nous réussissons tous à les appliquer. Les enfants de partout au Canada nous demandent ce qui va aider à aplatir la courbe. Ils renoncent à leur partie de soccer et à leurs activités avec leurs amis pour aider. Ils en apprennent sur l'éloignement physique et le lavage des mains au rythme des différentes comptines. Ils participent aux efforts pour ralentir la propagation du virus, ce qui est excellent. Suivons tous leur exemple. Nous savons que ces efforts exigent des sacrifices, alors travaillons ensemble. Prenons soin les uns des autres et veillons à notre propre santé mentale et physique. La COVID-19 nous a rappelé à quel point nous sommes à la fois vulnérables et interdépendants. Nous sommes plus forts ensemble. Merci.
Okay, thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics here. Operator, over to you for 2 questions on the line.
Thank you. Please press star 1 at this time if you have a question. There will be a brief pause while the participants register for for questions. Thank you for your patience. Et s'il vous plaît, appuyez sur l'étoile 1 pour poser une question. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Merci de patienter. La première question de Mia Rapson de Canadian Press. The first question from Mia Rapson from the Canadian Press. Please go ahead.
Good morning, Dr. Tam. I'm wondering if you could talk a little bit more about face masks in terms of, you've said many times that Canada wants to be a lot more like South Korea and Taiwan than let's say, Spain or Italy. But these are countries where they told people to wear face masks quite early on. Are you concerned that not giving that information to Canadians has contributed to the spread in Canada?
So we're always looking at evolving science, but some of the really critical measures is staying home and self-isolation. So whether someone is symptomatic, of course you should stay home. The question of the evolution of science on the how much pre-symptomatic transmission, for example, contributes to the epidemic is still undergoing evolution in terms of the science. However, if people who are meant to be self-isolating, stay at home, if you quarantine, those 14 days are there so that if you become symptomatic, you're already apart from others. So those are absolutely critical measures. Case finding, contact tracing, and social distancing. As I've said yesterday, we are actively reviewing the evidence right now with the provinces and territories. We'll have more specific recommendations in a very short time frame. I did say, though, there are 3 really critical aspects to our advice to Canadians. One is that right now, medical masks, including surgical and medical procedural face masks, respirators like N95 must be kept for healthcare workers and others providing direct care. Secondly, again, non-medical masks, so these are some of the examples that people have talked about in terms of homemade masks in the community hasn't proven to protect the person wearing it from getting the virus. So everyone must still practice strict hygienic measures and the social distancing measures. Stay home if you're sick. Wearing a non-medical mask is an additional measure that we're considering to protect others around you. So it's a matter of you protecting others. So these are the three key aspects. And what we want to do is to provide thoughtful advice to Canadians so that if they wear a mask, how do you do this properly? And I want to make sure we have good advice on, even amongst homemade masks, how do you do that properly? What materials are appropriate, for example? So all of this is under active discussion right now.
Thank you. One follow-up?
Thank you for that. I'm also wondering if you could talk a little bit about protections for healthcare workers. We've heard in other countries the number of healthcare workers that are falling sick is quite high, and here, without proper protection, seems that those numbers are there. What are you specifically trying to do to prevent those kinds of things from happening here? And why can't we know specifically what the shortage is of masks for healthcare workers?
So protecting healthcare workers is absolute priority. It is of paramount importance. So as we've all been saying, in every stop has been pulled out in terms of getting supplies. And globally, there is a very much a sort of competitive environment and a shortage environment. So we are doing everything that we can, not just getting PPE from overseas, where traditionally that's where they come from, but also the domestic supply. So some of these things are coming online and being delivered. But every day those numbers will change, and depending on the utilization of the mask and the deliveries. But we are also looking at very other measures, such as how can we disinfect, if you like, or decontaminate masks? How do we best look after the limited supply that we have? And many of the other measures, for example, that provinces are taking is ensuring that they designate wards or hospitals just to look after COVID-19 patients. And that also helps the stewardship and the conservation of personal protective equipment, because it'll be one specific area or one specific hospital where patients are being looked after so that they can look after that supply of the PPE. So many, many things are being done to ensure that we protect health workers. And the other thing is, getting a better understanding of the healthcare workers who are infected. I do know that, for example, it's not as simple as people think. Many of healthcare workers were perhaps infected in the community or through travel, and not necessarily through the actual healthcare facility. So you need to actually understand medical officers at the local level is in a very good position to understand the exact reason why healthcare workers have been infected, but also to protect the patients that they are trying to take care of. So that's really critical.
Thank you. Operator, next question on the line.
Thank you. The next question from Philippe Vincent Foisy from Radio-Canada. La prochaine question de Philippe Vincent Foisy de Radio-Canada. Excusez-moi, la prochaine question de Carly Weeks. Philippe Vincent Foisy qui avec la question.
Oui, allô? Oui, la voix à parole, Monsieur Vincent Foisy. OK. Monsieur Nou, la semaine dernière, vous avez répété que c'était une semaine critique. Vous avez dit ça toute la semaine est terminée. Est-ce que les Canadiens ont réussi l'épreuve? Est-ce que la semaine critique, elle est positive ou négative?
Merci pour la question. Oui, la semaine dernière, c'est critique, mais aussi cette semaine actuellement et aussi les prochaines semaines. Une partie de l'enjeu actuel, c'est toujours les données. C'est sûr que qu'est-ce qui se passe actuellement avec les données qu'on reçoit à l'échelle fédérale. Il y a déjà, ça représente les cas avec peut-être l'exposition il y a 2, 3, 4 semaines, parce qu'il y a toujours des délais avec une personne, avec une période d'incubation, puis si une personne tombe malade, chercher soins de santé, avoir un dépistage, un test, et puis les résultats des tests, et puis les rapports qui commencent à l'échelle locale, municipale, et puis ça monte à l'échelle provinciale, finalement, à nous autres. Donc, pour nous, c'est difficile à déterminer précisément à l'heure actuelle si on a fait on a réussi, mais si on voit qu'est-ce qui se passe dans les provinces et territoires individuels, comme en Colombie-Britannique, les autorités sanitaires ont dit que oui, il y a peut-être des résultats un peu optimistes, mais il faut penser avec un peu comme des précautions parce qu'à l'échelle nationale, c'est difficile. Donc, je pense que la chose la plus importante, c'est d'encourager tous les Canadiens et Canadiennes. C'est très important de continuer avec les mesures comme l'éloignement physique. On verra peut-être dans les 2-3 semaines qui suivent. Merci.
Oui, suivi.
Sur...
Thank you. Follow-up question. Votre suivi maintenant?
Oui, je vais poser ma question de suivi. Sur les masques, le gouvernement du Québec, la semaine dernière, disait que ça prend à peu près par semaine 1 million, en tout cas quelques millions de masques chirurgicaux, des millions de masques N95 aussi pour tout le système de santé. Ça, c'était juste au Québec. Partout au Canada, avez-vous un chiffre à peu près du nombre de masques que ça prend par semaine? Puis j'aimerais ça comparer avec la quantité de masques qu'on va recevoir de la Chine. On parle de 7 à 8 millions de masques. C'est suffisant, ça, pour quoi? 1, 2, 3 journées? Il nous reste de l'équipement médical de protection pour combien de jours jusqu'à ce qu'il en manque?
OK, merci pour la question. Oui, c'est un enjeu actuel. Tout le monde travaille très fort. Le gouvernement fédéral, on a une étroite collaboration avec toutes les provinces et territoires parce que c'est vraiment, comment dire, c'est l'équipe du Canada. Le gouvernement fédéral, avec les provinces et territoires, on fait des commandes, comme on dit, des achats en gros, et puis après, c'est une distribution selon un cadre d'allocation pour les provinces et territoires. Mais on sait ici, il y a des foyers actuels dans des régions spécifiquement, dans chaque province et territoire. C'est ça, c'est une priorité pour distribuer l'équipement de protection individuelle aux foyers où on a besoin. De plus, c'est difficile parce qu'on ne peut pas donner des chiffres exacts parce que c'est très fluide la situation avec les vols, la distribution, qu'est-ce qui se passe actuellement. Si on donne un chiffre maintenant, c'est sûr, peut-être dans quelques minutes ou quelques heures, c'est plus en vigueur. Donc, je pense que la seule chose qu'on peut dire, c'est qu'on continue à travailler étroitement. C'est toujours une situation qui évolue de jour à jour et on fait nos meilleurs efforts. Un autre aspect, c'est même si on continue à acheter ce qui est disponible sur le marché mondial, on continue aussi avec nos efforts pour avoir une capacité domestique pour la fabrication des masques ici au Canada pour toujours la priorité des travailleurs de soins de santé sur le terrain. Un autre aspect, on est en train aussi au Canada de faire la recherche. Les chercheurs aussi sont en train de trouver peut-être des moyens. Est-ce qu'on peut désinfecter l'équipement de protection individuelle déjà utilisé? Peut-être c'est une autre façon de conserver l'équipement qu'on a déjà ici au Canada. Donc, on a plusieurs volets, plusieurs composants de vraiment l'enjeu de l'utilisation et aussi de la distribution des EPI. Merci.
Thank you. We'll come to the room now for...
Should I repeat in English or?
Sure, please.
Same question. Obviously, Dr. Tam and I, we've been repeating. It's a very live issue in terms of getting the necessary personal protection equipment for our frontline workers, especially healthcare workers. It's difficult to give exact numbers because it is a very competitive global market. Certainly, we're pulling at all the stops. The federal government, in collaboration with the provinces and territories, we have what we call an allocation framework, so that when masks do arrive, there is a mechanism in terms of how we would distribute. Obviously, there are lots of factors in play. For example, if a given part of the country has a specific outbreak or a region that's particularly affected, certainly that would be a priority to get the masks that are available to that specific area. In addition to, obviously, the very competitive global market, we're also looking at increasing our domestic capacity. That won't happen overnight, but certainly efforts are underway to make sure that here in Canada, that we have the capacity down the road, hopefully sooner rather than later, to make, quote, our own personal protective equipment. So that's number two. And then number three, we're also actively with our researchers across the country looking at other ways that maybe we can even reutilize masks, as Dr. Tan was just saying, in terms of disinfecting them so that they can be used again. And that way we can also conserve the PPE we have here in Canada. Thank you.
Thank you. We'll now come to the room for 2 questions. Mackenzie.
Hi, Dr. Tam and Dr. New. Mackenzie Gray from CTV. Dr. Tam, yesterday when I asked you about masks, you said that the main reason why someone who wasn't sick at the point of showing symptoms should wear a mask is to not give droplets to someone else. That, to me, made it sound like there is some science that you've been looking about asymptomatic transmission or pre-symptomatic transmission. Can you speak to what the science is right now? And very specifically on that, in the period before someone shows symptoms, how early are they able to spread COVID?
So we are actually right now going to be reviewing this with the other chief medical officers and in terms of the studies that are available. They are actually limited. So with that, we will still be making some recommendations. What we do know is if you put a swab into someone's nose and throat, you will get the virus identified before someone is symptomatic. So that is a fact that we know about. When does someone transmit? That is the more difficult question. So there has been some studies, some of which are released in the last few days. For example, a study in a long-term care facility in the United States is showing that people who are pre-symptomatic, they will become symptomatic, but maybe 2 days or so. So we're looking at that period, how certain are we about 2 days, 1 to 2 days, 2 to 3 days, looking at that period that they could transmit before they have symptoms. We still believe that people with symptoms is the main force overall for the propagation of the actual outbreak. But in certain settings, as you can imagine, like long-term care, it is really vital to look at that because it can change practice, including the use of PPE, so that staff may not realize that they will become symptomatic, or residences who have many other medical conditions, for example, you can't tell. There are other things that we should be doing as well. So that's the live discussion that we're having, and we will be providing more information on that to come. There's also other laboratory studies where people are made to cough or do other things to see whether they can spread. And so there's different groups of studies that we're looking at right now.
One follow-up?
President Trump has been discussing the anti-malaria drug, and forgive me for the mispronunciation, hydrochloroquine, you two know what I'm talking about, as a potential treatment for this. What is Canada's position on this? Have we used this drug to treat people in Canada at any point during this? And it's also a drug that is used for lupus, according to my understanding. What are we doing to make sure that there is this drug set aside to make sure that people who need it for conditions that we know it'll actually help, to make sure that those drugs are there for them?
That's a very good question. We do not have any specific treatments, and none proven to work for COVID-19. But hydroxychloroquine is one that is being studied. So in Canada, we are part of those studies. So ensuring that we have hydroxychloroquine so that people who use it is part of a clinical trial. You can get data from them is part of what's going on right now. In terms of absolutely, I think our key message is that we do know this drug works for certain medical conditions. People with certain inflammatory illnesses, some of the immunological illnesses that you've talked about, malaria, prophylaxis, you must preserve those actual indications. So that we are working on that with Health Canada, that's a regulatory authority, with the manufacturers, and there are several of them. Some are manufactured in Canada. So we are monitoring the supply situation and looking to what we need for the purposes of patients who need them and the trials that it needs to be conducted. But it's definitely one on the list of treatments that we are looking at for COVID-19.
Ashley Burke, CBC News. You just mentioned you're monitoring the supply of that specific drug. Can you tell us about how much of it we do have here in Canada, and do we rely on a large bulk of it from the U.S.?
I know that there's several suppliers, and I know that there's domestic manufacturing. So I think I also know that there's a very a great deal of interest globally. So we are very alive to the fact that this supply, which we have, we need to, really, if we need to augment it, there is a domestic capacity to do so. But making sure we have enough of the patients that actually need it for other purposes, I think, is our primary concern right now. And so, but there is, I think, from my perspective at least, we have domestic capacity.
You were just talking about decontaminating and disinfecting masks and that process. Can you give us some more specifics of exactly what type of work you're doing right now on this, where we are at the process and how close we are to actually doing this? As well, what does it signal about our supply here?
So I think it's a multi-layered approach to the supply, and I think everyone is aware that the supply is a very dynamic situation, but there's a lot of need. So this is another method. So part of it is the science of decontamination of what works. And secondly, we are looking at multiple entities in Canada that might be able to actually do this. And also then signaling to provinces and territories that certain things shouldn't be thrown away right now, so that we can actually implement this should we find the actual, people who can do this. But I think that is one of the most important and I think worthwhile lines of pursuit for PPE right now.
Thank you. We're going to go to the line for 2 final questions. Operator, over to you.
Thank you. The next question is from Carly Weeks from the Globe and Mail. La prochaine question de Carly Weeks du Globe and Mail.
Hi, and thank you. Dr. Tam, I was just wondering if you could address something. You said last week this would be a very critical week in terms of cases and numbers. We have heard from officials in BC and to a lesser extent Alberta indicating that they may be seeing a bit of a slowdown. On the contrary, it seems as though the situation in Ontario and Quebec provinces that you singled out last week are accelerating. I was wondering if you could comment on how some of those situations might be evolving and what you're going to be looking for in the week ahead.
Yeah, I think that's actually quite a good summary. We will be looking towards British Columbia and maybe Alberta because they have a very different epidemiology to Quebec and Ontario. I think all chief medical officers are trying to be extremely cautious about what we're looking at because we know the situation can change. And with the delay in terms of what you're seeing right now in terms of numbers, again, is what happened several weeks ago. So that is absolutely important for everyone to know. And as I've said before, you won't know that you've passed a certain peak until you're actually on the other side of it. And it's always very difficult to make any pronunciation on that. So it is a day-by-day look. And so then I do think that Quebec and Ontario, even individually, have different epidemiology and different timing and trajectories. So, Quebec's dynamics will be different to that of Ontario, and the timing will be different. So we'll be watching each of these individual provinces very carefully as well. And we think they may have started a bit later than British Columbia in the epidemic as well. So the timing of when we will see the measures, I think, will be a bit different across the country.
Thank you. And one follow-up?
Sure. So maybe looking forward, casting ahead a week or so, how concerned are you if we do continue to see those, particularly those hospitalization and ICU numbers jump the way that they currently are in Ontario and Quebec?
So I think, again, the exposures to those individuals would have happened at least, a couple of weeks ago. So what happens is we do have to look at everything again on a daily basis, because I'm aware that each of the jurisdictions have layered on even more additional measures in the meantime. So you will be seeing the impact of what happened like a couple of weeks ago, and then there's even more measures being done since then. And so I think we just got to be able to watch this day by day. But just to really emphasize that what things happen in the next ensuing weeks is dependent on what we do today. So if we don't keep on going and absolutely tighten up our social distancing, self-isolation, case contact measures, that's what's going to impact a couple of weeks down the road. So that is a really important concept that everybody has to grasp. What will happen 2 weeks down the road is what happens today. So it's just a concept that I think Canadians need to be aware of.
Thank you. And one final question on the line.
The next question is from Mo Fahim from Vista Radio. La prochaine question de Mo Fahim de Vista Radio.
Hi, good morning, doctors. My question is regarding, is the federal government considering to emulate how some Eastern countries are providing accommodation for healthcare workers so that they can absolutely minimize any contact between them and people around them? Is the federal government considering anything close to that?
We are looking at everything, basically, to slow down the spread of the virus in this epidemic. And so these are some of the kind of discussions that we do have with provinces and territories. That's a very good question. And if you look at what the provinces are already doing, I'm aware, for example, yesterday Manitoba actually articulated the precise thing that you just described, is making sure health workers, should they need a place to self-isolate, to not just protect themselves, but to protect their families, they're looking at the support for them to do so. So absolutely, that's one aspect of our response that we can offer support for, should that be needed.
Thank you. And one follow-up?
Thank you. I don't have a follow-up. Thank you so much, doctors.
Merci. La séance est maintenant terminée.
That concludes the question. Thank you. The conference is now ended. Please disconnect your lines at this time.
No, just going to ask her a question.